Hello and welcome to the Neurology channel. Today we're delving into a fascinating topic that many migraine sufferers are familiar with, all about auras with migraines. What are migraine auras? To start, let's demystify what migraine auras are. Auras are sensory disturbances that some people experience before or during a migraine attack. Migraine auras are a set of sensory disturbances or experiences that some individuals with migraines may encounter before or during a migraine attack. These disturbances are often characterized by various perceptual changes and neurological symptoms and typically serve as warning signs that a migraine headache is imminent. What are the types of auras? Did you know that auras can vary from person to person? There are different types of auras, and they're not limited to just visuals. Migraine auras can manifest in various ways, and they are categorized into different types based on the nature of the sensory disturbances or neurological symptoms experienced by the individual. Here are some common types of migraine auras. Visual auras. Visual auras are the most prevalent type of migraine aura. They involve disturbances in the perception of visual information. Common visual aura symptoms include scotomas. These are blind spots or areas of decreased vision in the visual field. They can obstruct parts of the visual field, making it difficult to see clearly. Scintillating scotomas. These are shimmering or flashing lights that may move across the visual field in a zigzag or wavy pattern. They can be colorful and often expand over time. Blurred vision. Vision becomes blurry or out of focus, making it challenging to see objects clearly. Photophobia, increased sensitivity to light, where even normal levels of illumination can be uncomfortable or painful. Sensory auras. Sensory auras involve abnormal sensations in the body. These sensations can affect various parts of the body, such as the face, hands, or limbs. Common sensory aura symptoms include tingling or numbness. A tingling sensation, often described as pins and needles, may occur in the face, hands, or other parts of the body. Paresthesia. This refers to abnormal sensations like prickling, burning, or a crawling feeling on the skin. Altered sensation. The perception of touch or temperature may be altered, with individuals experiencing sensations that are different from the norm. Speech and language auras. In some cases, auras can affect speech and language functions. These may include difficulty finding words. Individuals may have difficulty recalling or articulating words. Slurred speech. Speech may become slurred or difficult to understand. Language comprehension issues. Difficulty understanding spoken or written language. Motor auras. Motor auras are less common but can involve motor or movement-related symptoms. These might include muscle weakness, temporary muscle weakness, often described as feeling heavy or having difficulty moving certain body parts. Coordination problems, difficulty with coordination and fine motor skills, such as writing or buttoning clothing. Mixed auras. Some individuals may experience a combination of different aura types during the same migraine episode. For example, they may have visual disturbances along with sensory symptoms. Hemiplegic migraine. Hemiplegic migraine is a rare subtype of migraine with aura that involves temporary paralysis or weakness on one side of the body, hemiplegia. Other symptoms, such as visual disturbances or speech difficulties, may also be present. It's important to note that the specific symptoms and their duration can vary widely from person to person. Additionally, not all migraine episodes are accompanied by auras. Understanding the type of aura experienced and its associated symptoms can be helpful in diagnosing and managing migraines effectively. If you or someone you know experiences migraines with auras, it's advisable to consult a healthcare provider for a proper evaluation and individualized treatment plan. What causes auras? But what causes these auras in the first place? It's believed that auras result from changes in the brain and the way it processes information. The exact cause of migraine auras is not fully understood, but they are believed to be related to changes in brain activity, particularly within the visual and sensory processing areas of the brain. Several theories and factors have been proposed to explain the underlying mechanisms of auras in migraines. Cortical spreading depression, CSD. This is one of the leading theories explaining the cause of migraine auras. According to the CSD theory, a wave of depolarization or spreading depression moves slowly across the cortex, the outer layer of the brain, during the aura phase. This wave of electrical activity can disrupt normal brain function and lead to the sensory disturbances experienced during an aura. Blood flow changes. Some researchers believe that alterations in cerebral blood flow play a role in migraine auras. Changes in blood flow may affect the supply of oxygen and nutrients to brain cells, leading to abnormal neural activity and the manifestation of aura symptoms. Cortical hyperexcitability. It's been suggested that individuals who experience auras may have a heightened susceptibility to cortical hyperexcitability, where certain areas of the brain become more prone to abnormal electrical activity. This hyperexcitability may be triggered by various factors, including changes in neurotransmitter levels. Neurotransmitter imbalance. The levels and balance of neurotransmitters in the brain, such as serotonin and glutamate, may influence the development of migraine auras. Changes in these neurotransmitters could lead to increased neural excitability and the initiation of aura symptoms. Genetic factors. Migraine auras often run in families, suggesting a genetic component. Certain genetic mutations may make individuals more susceptible to experiencing auras during migraines. Triggers. A variety of triggers can set off migraine attacks, and these may also play a role in the onset of auras. Common triggers include stress, certain foods, hormonal changes, and environmental factors. The interplay of triggers with genetic predisposition may contribute to aura development. Cerebral spreading allogemia. This theory suggests that during a migraine aura, there is a temporary decrease in blood flow in specific brain regions, referred to as allogemia. This decrease in blood flow may trigger aura symptoms. It's important to note that the exact cause of migraine auras may vary from person to person, and it is likely multifactorial, involving a combination of genetic, neurobiological, and environmental factors. Additionally, not all individuals with migraines experience auras, and the specific symptoms and duration of auras can differ widely among those who do. Understanding the underlying mechanisms of migraine auras remains an active area of research. Individuals who experience migraines with auras should consult with a healthcare provider for proper diagnosis and management, as various treatment options and lifestyle modifications can help mitigate the impact of migraines and their associated auras. Managing migraine auras. So, how can you manage migraine auras? It's crucial to work closely with your healthcare provider to develop a personalized plan. Managing migraine auras involves a combination of strategies aimed at relieving the symptoms of the aura, preventing the onset of a full-blown migraine headache, and improving overall well-being. Here are some effective approaches for managing migraine auras. Identify triggers. Keep a migraine diary to track potential triggers that precede your migraine attacks, including auras. Common triggers include stress, certain foods, hormonal changes, lack of sleep, and environmental factors. Identifying and avoiding triggers when possible can help prevent auras. Medications for acute treatment. If you experience auras, it's important to have medications prescribed by your healthcare provider specifically for acute migraine treatment. These medications can help alleviate the symptoms of the aura and may help prevent the progression to a full migraine headache. Common medications include triptans, nonsteroidal anti-inflammatory drugs, NSAIDs, and anti-nausea medications. Relaxation and stress reduction. Stress is a common trigger for migraines and auras. Practice relaxation techniques like deep breathing, meditation, progressive muscle relaxation, and yoga to manage stress and reduce the likelihood of aura episodes. Stay hydrated and maintain regular meals. Dehydration and skipping meals can trigger migraines and auras. Ensure you stay well hydrated and maintain regular, balanced meals to stabilize blood sugar levels. Adequate sleep. Getting enough sleep is crucial for migraine management. Establish a consistent sleep schedule and create a comfortable sleep environment to reduce the risk of auras. Prescribed preventive medications. If you experience frequent and severe migraine auras, your healthcare provider may recommend preventive medications. These drugs are taken regularly to reduce the frequency and severity of migraine attacks, including auras. Common preventive medications include beta blockers, anti-epileptic drugs, and certain antidepressants. Lifestyle modifications. Identify and modify lifestyle factors that may contribute to migraine auras. This could include avoiding certain foods known to trigger migraines, limiting caffeine and alcohol intake, and maintaining a regular exercise routine. Biofeedback and relaxation training. Biofeedback techniques can help you learn to control physiological responses like muscle tension and skin temperature, which can contribute to migraines and auras. This form of therapy is often used in conjunction with relaxation training. Stay informed and seek support. Educate yourself about migraine auras and available treatments. Stay informed about new research and therapies. Additionally, consider joining support groups or seeking the guidance of a healthcare provider specializing in migraine management. Consult with a neurologist or headache specialist. If your migraine auras are frequent, severe, or significantly impacting your quality of life, consider consulting with a neurologist or headache specialist. They can provide a thorough evaluation and personalized treatment plan. Emergency medical attention. In some cases, migraine auras can be associated with more serious conditions. Seek immediate medical attention if you experience new or unusually severe aura symptoms, or if your symptoms are accompanied by other concerning signs, such as weakness on one side of the body or difficulty speaking. Managing migraine auras involves a comprehensive approach that addresses triggers, symptom relief, and prevention. It's essential to work closely with a healthcare provider to develop an individualized plan that best suits your needs and helps improve your overall quality of life while minimizing the impact of auras and migraines. In conclusion, auras are a unique aspect of some migraine experiences. Understanding them and working with your healthcare team can help manage and even prevent these episodes. If you found this video helpful, please give it a thumbs up and subscribe to the Neurology channel for more insightful content. And remember, you're not alone in your migraine journey. Thank you for joining us today on the Neurology channel. Stay tuned for more informative videos on neurological topics. Take care and be well.